Hello, this is Corey Scarpaccio. Thank you for joining me. Today I have Lena Picciaro here to go over some of the Cavitron options for you, and here we go.
Hello, hi, I'm Lena Picciaro with Dentsply Sirona, as Corey said. This is your SBS option for Cavitron. This is our entry-level unit. She's a workhorse, very tiny, so she fits in a lot of nice spacing. Has a magnet here for your handpiece. Power control is here. Water control is on your handle. Now these SteriMates come off, so you can buy multiples. When you do that, these will last longer. It's a good infection control measure to use these after every patient that gets sterilized. It goes back on the handle and you're ready to go. So we like to have a couple on hand, one in use, one in the sterilizer, and one in the drawer. So you definitely want to have multiples of these for infection control purposes. The SPS comes with a wired foot pedal. Overall, great entry-level unit for the price. Corey can give you pricing on it, and we have rebates as well.
Thank you so much. Now, just a few questions. The first question is, on here, can our providers use a sleeve for sterilization?
Yes, absolutely. You can use a sleeve. It's not going to be as effective as sterilizing after every patient, but yes, you can use a clear barrier.
Okay, thank you so much.
You're welcome.
And what about the inserts? Those are sold separately, or do they come with the unit?
There are two different options. You'll get one insert with the unit alone. And if you get the package, you'll get one universal that comes with it. And then you get to pick any of the three that you like.
Okay, so let's take a look at that in just a moment. This is the universal that comes with it. Can everyone see that? A nice thick handle. Thank you. And that's teal. And then the other choices
are going to be your heavier, the blue, and you have different options depending on how many bends you want. One bend, two bends, or three bends.
Okay.
And that's for your heavy calculus. That's going to be higher power on your unit.
I see, and you can see the dial here going from lower to higher. All right, well, again, thank you so much. That's the first option. If you'd like to see more, watch the next video. Hello, this is Corey Scarpaccio, and today I'm going to be showing you the next item up, which is the Cavitron Plus. Again, my guest is Lena Picciaro with Cavitron with Dentsply.
Hello. So we have the Cavitron Plus here. This is the next step up. It has a little bit more features, some more bells and whistles than the SPS that we just showed you. Your power control is going to still be here. And your water control is still on your handpiece. This is the same SteriMate handpiece. This comes off as well for sterilization purposes. You want multiple of these so you can sterilize them after every patient and be compliant with infection control.
Now, how many come with the unit?
One is going to come with the unit.
Okay.
And you can buy additional. Go. On this one here, I'm not sure if you can see the buttons, but when they illuminate, this one says service. This will flash when you're due for service. If there's something going on inside, if it needs to be recalibrated or it needs to be sent in for a technician, you'll see here a service button. The battery life is for your foot pedal. It is a cordless foot pedal. We have a cord that attaches to the machine and the foot pedal so that you always have power. But if for some reason the battery is low, this will illuminate here. Your boost. Foot pedal has two different speeds, one level and then two levels. First level is going to be whatever level you are here as far as power goes. The second level is going to take you into boost, so this will illuminate. It gives you a little bit more power in case you have an area where maybe you have a bridge of calculus that you need to work on. You can use your foot pedal to push down a little harder to get a little bit more boost in that power. Turbo is the same concept. Turbo, you can push here and keep that on, and it gives you more power. And purge, we should be purging our units every day in the morning, at lunch, and at the end of the day. So what happens is you take your handpiece, you can put it into the sink, you push purge, and for 1 minute it's going to purge out the water line. That helps to minimize that biofilm that gets caught up in the water line. Same thing with the inserts. You have 2 different purchasing options for your Cavitron. You can buy the unit alone, which will come with 1 universal insert, like such. If you get the package, it's a bundle deal. You get 1 universal, and then you get to pick another 3 that you like.
So they can choose another 3 universals or the blue that we spoke about earlier?
You can pick any of the ones that are here. You can pick 3 more, green. You could pick 3 more blue. You can pick a variety depending on what patients you see, what type of patients you see. We have a very thin insert here for light calculus. We have a yellow one for implants. So just depending on what kind of practice you have, you will get 4 in total with the package.
Got it. So 4 inserts with the package, 1 when it's purchased individually.
With just the unit alone, that's correct.
Got it.
Perfect. So that's our SPS Plus unit. Great product.
Well, it looks lovely. Let's look at the next one. Hello, it's Corey Scarpaccio with Benco Dental. We're on to our 3rd product in the Cavitron line. Now this product is a little fancier. It used to be the Tower. No, that's not right. It used to be the Touch. And now they've gone on to the next generation, and it's called the 300. Let's check it out.
Hi again. So this is our newest Cavitron to our portfolio. It's the Cavitron 300. This is a totally new design. This has been out on the market for about 5 years. As Corey said, this is a 2nd generation, the Cavitron 300. And it has a digital platform versus the others that are analog. Something that I like, I'm a hygienist of 20 years, you can adjust the power here and give a quantitative numerical value to the power that you're applying to your patient. So for example, in your notes, let's say that the patient was comfortable at a power of 40. You can document that in the chart, and when the patient comes back, you can say, you can start with 40, and if 40 is good for them, that's perfect. Let's say 40 is too much power. I would have a conversation with my patient to say, what's different? There's something that's changed in the last 4 months. I used 40 on you last time. This is a little high for you this time. They may tell you, I changed my toothpaste, or I've changed my toothbrush, or I changed this and the other thing. It gives you a conversation, allows you to have a conversation about this number. Let's say your patient comes in and today you can do 45. That's great. You can go up on power without discomfort from your patient. You can also, again, have that conversation with your patient to say, look, at today you're at 45, what's changed? And hopefully you get the answer that I've been flossing, or I've been using the electric toothbrush that you recommended. So you can see improvement on that number. So a quantitative way of documenting in the chart what power your patient is at. This is the first of its kind. There is nothing like this on the market.
So you're able to actually personalize their care with this particular Cavitron.
That is correct. Yep, this is as personalized as it gets. Cavitron Sterimate is the same as far as removing it and sterilizing it in between every patient. Again, the more you have, the more you can circulate and rotate, the longer they will last. Your water is here on your handle. This is a featherweight, lightweight cord. We've removed one of the cords from the handpiece, so it's lightweight, good for ergonomics on the hygienist's wrist.
Now let's just take a moment here. This cord is decidedly thinner and lighter than we saw previously. Are we able to put these next to each other and take a look?
Sure, absolutely.
All right, so let's hold up the 300 cord, and I will hold up the traditional cord. Now, this may not look like a huge difference to you. However, those of us in the dental world know what do we know about a cord difference?
Oh, it's a big difference. And this cord weight will make or break your career at the end of 30 years. This has a swivel on it. This does not have a swivel. Again, we're talking about ergonomics here. This here will also swivel for your finger, so you're not rotating your hand. This is a swivel piece. This is a 360 swivel. You do not have that on the other units.
Okay, so that's why this unit here is more of a deluxe model, as it were. Okay.
Correct.
Okay.
Going back to the face of the unit, you can customize your settings on the side here.
Okay.
Very easy to do, just like your radio. You can push the button and it will reset it to wherever you prefer. Maybe you have a Monday hygienist, a Wednesday hygienist, a Thursday hygienist, or maybe you prefer to do it based on treatment. So let's say you like to do 25 for your prophies. Let's say you like to do, and I'm reading this backwards, so I apologize. Is this 50? That's 50.
You're at 20.
Oh, I'm at 20. So let's say I wanted to customize it to based on my procedure. Sorry.
Right.
So let's say you wanted 50 for scaling and root plating. Let's say you wanted 75 for gross debridement. So when your patient comes in, now all you do is.
So you that quickly were able to personalize those three numbers and have them set for the patient.
Correct. It's that easy.
Wow, that is definitely touch and go.
Yes.
Look at that. That is lovely.
You can push here to lock the screen and you can wipe this.
Oh, here's the lock button here. Lock and unlock right here.
Yep. That's for your disinfecting. You can use a tape on the top and peel the tape off and then wipe afterward.
Okay. Yes. I think a lot of us have seen more and more barriers these days that are used.
Agreed. Wireless foot pedal. It does communicate via Bluetooth.
Okay.
And you have the inserts. We had this conversation on the other two, but I'll show you here.
Okay.
You do get one insert when you buy the package.
So again, that's the universal.
This is the universal, and you'll get 3 more when you register. So you can pick from the entire portfolio. Green is going to be your everyday medium power. Blue is going to be for your heavy calculus higher power.
Okay, so something I've noticed, and let's keep things straight, these inserts can work across the board, the portfolio of Cavitrons.
Correct. As long as it's a 30K, these are 30K inserts. These are 30K machines, yes.
Okay, so there is the availability then for someone to purchase perhaps one for one room and then an upgraded deluxe model for another room.
Absolutely. And they would take the same inserts as long as it's 30K capable.
Lovely. Okay. Anything else that we should know about this particular Cavitron unit?
I think we covered all the basics.
Yeah. Okay. It looks amazing. So if you are interested in seeing one or all of these units, you know what to do. Contact Corey. Hello, it's Corey Scarpaccio with Benco Dental again. It looks as though we're on to yet another item from Cavitron, and I must say, I thought the 300 was interesting. However, this is the Cavitron Jet Plus.
Yes, that's correct. This is our combo unit. This is a 2-in-1. So we have a Cavitron and an air polisher in one unit. This is great for those offices that have a little bit of real estate and they don't have the space for 2 machines, but they want to use the air polisher function on this machine. So this is 2-in-1, air polisher and Cavitron together. Your power is going to be over here, just like the other ones. Air polisher functions are over here in purple. You have one handpiece for both. So your inserts, your Cavitron inserts fit in here. And your air polisher inserts fit in here. So it's the same handpiece for both. Now on this one, the cord is a little heavier because you have an air line and you have a powder line. So it's a little bit heavier, but very manageable. The SteriMate comes off for sterilization purposes. You want a couple in rotation, so 1 in use, 1 on deck, and 1 in the sterilizer.
So again, with this unit, how many come with the unit?
With the package, you're going to get 3 of these, so you'll be fully equipped with the package.
Oh, perfect.
Your water line is here. This is where your powder is housed. This is nice because it is not on your handle. I've seen some where there's a handle with powder. It's very heavy on your hand. This is actually part of the machine itself that sits on the table, so you don't have that extra weight on your hand. Lid comes off. Very easy to use. You pick your powder.
Now, how much powder can be housed in here?
The bulb here, you want it to be filled about 3/4 of the way full.
And about how many patients would that service?
This is gonna be good until about lunchtime.
Oh, okay.
So you usually will fill it in the morning and then at lunchtime.
All right.
Maintenance is a big deal for this machine. This one requires a little bit of maintenance at the end of the day. You want to empty the powder out every night. We live in Florida, so it's very humid. So you want to make sure that you maintain this by emptying this out and purging the unit. You want to, when you open this up and you empty the contents, you want to turn the machine on and let the air blow out. It'll blow out the machine and then the machine is ready to go. I have offices that will suction this with a high-speed suction. That's a good idea as well. Or take a toothbrush, keep it under your sink, and you want to brush around the O-ring and around the outside here so that you always have a nice seal.
Oh, I can see why that would be important. You wouldn't want the powder to impact your seal because you want the machine to continue working as well as it does. Let's see the powders choices that we have.
So we have 2 different options here. We have a sodium bicarb, which you're going to use most of the time. This has salt in it. So if you have a patient who is compromised, maybe a kidney patient or a cardiac patient or somebody who is on a low sodium diet, we have the aluminum trihydroxide.
So with sodium in it, we've got green, and this is mint flavored. And then over here, this has no sodium, and this is blue, and it is also mint flavored.
This has a wireless foot pedal as well. There's no cords. We do have a cord that will attach it to the machine in case you have no power. You're not going to be without your machine, but it does come with a cordless foot pedal.
So the hygienist has the option of having the corded foot pedal or utilizing the battery.
Correct. This one comes with inserts as well. The package is going to come with 4 in total. 1 comes with the unit in the box, and when you register for your unit, you'll register for the other 3. We have a variety here. You can see the blue is for for heavy calculus. This is going to be on a higher power. The green is more for your everyday medium power. We have a purple one, very thin, light power, light calculus. We have one for implants. So we have an entire portfolio. You will get 4 with your package.
So it looks as though this machine really does it all. You have the Cavitron, you have the Profi, and that looks like you don't need anything else on your counter, just this one machine. Is that correct?
That is correct. This one does everything. If your patients are used to hair polishing, this is the way to go.
Sounds great. So if you'd like to purchase a Cavitron Jet Plus, or perhaps hear more about it, you know what to do. Contact Corey. Hello, this is Corey Scarpaccio with Benco Dental. Today I want to just recap a few of the things regarding the Cavitron machines that you've seen in the individualized videos. Let's see all 4 machines and hear a little bit about each as they are side by side.
Hello, so this is our entry-level SPS unit. Workhorse, very simple to use, very low frills. Great unit.
So that's the workhorse.
This is the workhorse.
Okay.
Cavitron Plus, built the same way as the workhorse. It just has a couple more features on it. It has a boost in the pedal. It has a turbo button for some harder to remove calculus.
So this machine's going to really get things done.
It's going to get the job done.
Got it.
Yes. The next one is our Cavitron 300 series. This is our digital platform. Very customizable, very easy to use. Has a digital
Display.
thank you.
There you
that
go.
you can use the numbers in the charting to customize patient treatment. Great unit.
Definitely the Now machine.
The Now machine. This is 2021.
Absolutely.
Just so you know, the cord here, we've removed one of the wires, so the cord is much thinner and lighter. It's very, very nice for the clinician as far as cord drag
Beautiful.
and ergonomics. And this is our combo unit. This is the Jet Plus. This has a Cavitron and an air polisher in it. This is a 2-in-1 unit. So you're getting both Cavitron and air polisher.
So you're getting the most function out of this machine.
That is correct.
Lovely.
Yeah.
Well, there you have it. That's the entire line here for you to view. And if you would like to see these machines in your office that suits you the best, by all means, let's get you the machine that is best for you. Contact Corey. So you've heard about these machines. You've seen them all. They're amazing. I think any choice you make will be lovely for your patients, your practice. And what I want to go over now is the registration of the machines and how that goes. You may have heard us reference it earlier. So here we'll go over that. So take it away.
Registration is very easy on these machines. When you receive your box, you open the box, the first thing you see is some paperwork. On there's a website. You're going to register your unit for your warranty purposes and for your insert selection. It's as simple as that. You have an invoice, they ask you for an invoice, you have to upload, and once you submit it, it's a one-page document. The inserts are processed and sent directly to the office.
So they choose their inserts, they come right to the office. Now, what about the maintenance of these machines?
The maintenance, that's a great question. So each one of these machines has the maintenance option that's built into the package, and it's designed so that we can help you keep your investment going. So, for example, Cavitron Jet Plus, there's a 3-year maintenance on this. So what happens is once a year for 3 years, you want to send this up to Cavitron Care and have our mechanics work on it. It's a 28-point inspection. They open the machines up, they clean everything out, they recalibrate everything. If anything needs to be resoldered, they resolder it and send it back to you.
Wow, it sounds like Cavitron really stands behind their products.
We do. We're going to give you a loaner so that you're not without a machine, and we pay for shipping there and back.
Lovely. All right. Is there anything else regarding these that you would like us to know?
Nope. We just appreciate your business. This is the gold standard of hygiene. Cavitron is the way to go. Thank you for your support.
Absolutely. So once again, if there's anything else that you would like to see, I'll give you a last look at each machine. Choose the one that fits your practice best, and we'd love to help.